DLD is a permanent communication disorder that makes it harder to learn and use language, affecting roughly 2 kids in every classroom. If a child shows signs of language difficulty, they're usually assessed by a specialist who compares their skills to other kids their age.
The problem is when you have immigrant children or bilingual children who come and do not speak English as a first language, those assessments are not validated for them. Their performance is not going to be up to par, which of course it makes sense. They're learning the language. But at that point, we don't know, is it because they're just learning the language, or is it something else like DLD?
One father says the new assessment better reflected his Spanish-speaking kids' potential.
It's a great opportunity to assess the child in a very wide perspective, where you can start to notice those things that are not based on correct results, but on the ability and the things that they could achieve.
The assessment uses 2 storytelling tasks with a teaching break in between to measure progress.
We want to see, can the child learn those skills? And to what extent can they learn those skills? And what does that learning look like? It's within that where we can actually measure the child's learning potential.
A speech-language pathologist looking to use the new assessment in her practice says it could replace the patchwork of tests often needed to fairly evaluate multilingual kids, calling it long overdue.
Most of our assessments for speech-language pathology are actually created in the Midwestern states of America and normed there. A fair assessment does lead to earlier, more appropriate intervention. It can reduce family stress on the child, allow for better learning, more tailored learning in that classroom, and really tap into the potential of the child.
Laurie is working to bring the assessment to professionals not only in the Maritimes but globally. Riti Meenakshi Rohila, Global News, St. John.